All right. Well, welcome everybody on this Wednesday afternoon for the COVID-19 update and staying at home class with Bobby Farlice-Rubio that we do each week at the Fairbanks Museum and Planetarium. This is actually our final class this week as the state begins to open up a bit more, but I'll let Bobby say some more about that when he takes over in a minute. We're excited to have some really interesting and wonderful guests for you today. Just a quick reminder, if you are in our Zoom meeting and you would like to ask any questions, you can mouse your cursor down to the bottom of your screen and you'll find a Q&A box there. That's the best place to ask some questions of us. You can also use the chat box, and within that chat, you can chat with Bobby or myself or any of our other presenters today. The other folks who might be on YouTube or might be watching this on Kingdom Access Television or your own local cable television, please remember you can always ask us questions, or you can ask any of our partners who you see on class today questions as well. All you need to do is send an email to dbush@fairbanksmuseum.org. That's dbush@fairbanksmuseum.org. We're happy to answer them for you or to forward them on to any of our partners here to answer your questions as well. So without further ado, I will now turn things over to Bobby Farlice-Rubio so we can start with this week's update.
Well, thank you, Drew. And thank you, everyone, for tuning in. And thank you, Laurel, for joining us once again for what is our last COVID-19 update. But unfortunately, I wish this was because our situation was over, but we're far from that. We're just now getting used to the idea of going back into a public and going back into work, but by no means is the situation completely solved yet. And I want to make sure no one gets that impression, because our continued vigilance is going to be more important going into the future. Even without these COVID-19 updates, I hope people realize that this is becoming a new normal. I was one of those people who was very optimistic at the beginning of all of this, maybe thinking, oh, maybe 3-4 months and we'll get it under control. Maybe we can do that. And at first it kind of looked like that, but I think it's fair to say that we have to adapt for a long-term situation. We might one day see a world that's normal, but instead of thinking about that, we should be thinking about how we're going to get through the next year or two. So with that in mind, before we speak with Laurel, I want to go to the numbers as we've always done with these updates. I'm going to start by heading over to the Johns Hopkins website, that is the coronavirus dashboard, which I'm really sad to say, when we started doing these, the numbers of cases were in the hundreds of thousands and the numbers of deaths were in the low thousands. And now the total confirmed number of cases of COVID-19 in the world is 4,298,269. And the number of deaths is 293,514. So well over 250,000 people on this planet have died from this disease. And unfortunately, the United States is in the lead with more than a quarter of all cases at 1,372,855 Americans stricken with COVID-19. And we have suffered, unfortunately, 82,504. Oh, actually, I'm sorry. The number has been more recently updated, 82,806 deaths, which not only is that more than the number of American casualties during the Vietnam War, but recently we've been having a number of deaths that's equal to a Hurricane Katrina scenario on a daily basis. And Hurricane Katrina was a tragedy, but we're doing that kind of tragedy on a daily basis here. So that is the reality. I don't want to let that get lost as much as we have good news out there. Let me go switch to the US map, because some of the good news comes from the fact that here in the Northeast Kingdom, I want to thank every citizen and every member of this community that has done so much to help restrain this virus by staying at home, by washing your hands, by maintaining social distancing, by wearing these masks. And I'm on my second one now in my fashion collection. So right now, let me zoom in on Vermont in the US map. Oops, sorry for that. You can see that where, oh, I apologize. My trackpad is having fun with this. The county where we are, Caledonia County, still only has 14 confirmed cases. I'm very happy to know that that number is so low. Our neighbor to the east, Essex County, only has 2 confirmed cases. and our neighboring county in the Northeast Kingdom to the north, Orleans County, only has 9 confirmed cases. So with that in mind, there could be an impression that, we're done. We're over this. We don't need to worry. There's only so few cases. But that's what I'm afraid of. And we'll talk with Laurel about that, because I'm afraid that people might take it too lightly, and then we could actually see a major increase here. Well, now, just to move on to more locally, our state has their website. And in addition to talking about the numbers, I'll give you the latest update for the state of Vermont. But there's also some new announcements, and that's about pop-up testing. I'll talk about that next, and I'll ask Laura to help us with that. But just going down the daily update, in the state of Vermont, there's a total of 927 cases of COVID-19. 5 people only are currently hospitalized, which is luckily a very small number. And sadly, 53 Vermonters have died from COVID-19 in the last few weeks. So moving it even more locally to our local hospital, NVRH, and their website, if you click on their coronavirus dashboard, you can see that 794 tests have been conducted at NVRH. Only 13 people have tested positive. And as it's been the case for the last several weeks, there are no patients at NVRH currently being treated for COVID-19 specifically. So with that in mind, before I ask for Laurel's contribution, I wanted to bring up a little bit more data just to reinforce the point that this is not settled everywhere. Some countries have managed to get a control over their coronavirus numbers, and some countries are still having increasing cases. And as I've been constantly referring to, the New York Times has been giving up free coverage, no subscription required for anything related to coronavirus. So I'm going to head to their, I'm going to head to a article that they have, the coronavirus map that's tracking the global outbreak. But first thing I want to say is, when we first started doing these and we first started talking with you, Laurel, we had hoped that we could flatten the curve. And it looks like as a nation, we have flattened that curve, although it is still pretty high in the number of new cases. But if you go around the world, and that's what's great about this article, you can see the curve for so many countries. And these top lists of countries is where new cases are increasing. And unfortunately, you can see many countries, some rich, some poor, some in cold climates, some in hot climates, are having still vertical climbs in their curve. And that's what we want to see go away. The good news is that these are the countries here, including the United States and Spain and the UK, where the number of cases are starting to level off. And the last category is the countries, which include Canada, our neighbor to the north, in which cases, new cases are decreasing. So I see a lot of hope in this page, this section, where we see that there is a possibility to get the numbers to really sharply decrease. The question is, how are we going to do it? And in our country, it's all going to be up to our own behavior. So not to add on too many things, but I was going to ask Laurel about how you're feeling now. How is the hospital doing, and how are you doing personally? But also, how do you feel about this time that we're in, where we're seeing people start to open up and start to get back to work? Some of us have gone through the VOSHA training. So how is this affecting the hospital for you right now?
Sure. So first of all, hi, Bobby, and hi to all the viewers out there. I really appreciate that you started with the things that people can do, which is, it's just 3 pretty simple things. You want to continue with washing your hands and keeping that physical distance, and also wearing masks. So this is a virus. It spread, thank you. It spread mostly by people to people coming in contact with each other, coming in contact with someone who has the virus. Those are the main ways. And so that's why the washing your hands and keeping the distance and wearing the mask really make a difference. And I really feel that that is why that we've been so far, we've done really well in this state, and particularly in the Northeast Kingdom, because people have followed those rules and they've been very diligent about it, and that's made a difference. And if you remember in the beginning, the whole idea behind flattening the curve is because you did not want to overload the healthcare system. And unfortunately, a good example of overloading the healthcare system was what happened in New York City. and in some of the more populated areas where, they ran out of medical supplies and they ran out of hospital beds in their ICUs and ran out of ventilators. And that's what we didn't want to have to happen here. And there was a lot of modeling going on in our state. It could have happened. We weren't that far away from it just a few months ago, and it wouldn't have taken that many cases in order for our healthcare system in Vermont to have been overwhelmed. But thanks to everybody here, we've been able to keep that down. So I think as far as how we're doing, I can't speak for everyone here. I think it's really an emotional roller coaster. Every day, things are still changing constantly. You're getting new information. Sometimes it's good information. It's like, yay, we can do this. We can ease up on this. But we have to be very adaptable. And I think we've proven that we can, for sure. I'm very proud of this hospital and the other healthcare partners and our community partners in our area. We've been very, very adaptable. And to literally things changing day to day, week by week, sometimes even, within hours.
Well, I see that the uncertainty about this virus being so new, that everybody is learning, everybody's like, a beginner at treating this and dealing with it. And all the professionals are, constantly having to update their protocols. And I hope that doesn't give people the feeling that they don't know what they're doing. It's just that there's so many cases and so many novel treatments. I mean, I've heard of things like laying someone on their chest. That was something that was discovered in practice at many hospitals and quickly spread. Is that the kind of things you're talking about, like medical practices?
Yeah. So, we have, physicians here, much smarter than I am, that are keeping right up with that latest things. And what you talk about, having people be in the prone position, that's something that was discovered earlier on in other parts of the country, where that works really well, having people be in the prone position. That means you're laying on your stomach. And so it helps with people breathing, being able to breathe better. And so, we're prepared for that. We actually we kind of won through a website. It's called Prone to Help or something like that, .org. And one of our employees here put in to win one of their prone pillows that we have. We haven't had to use it yet because we haven't had an inpatient since we got it. But it's supposed to make it very much more comfortable for someone to lay on their stomach for prolonged periods of time. So, we're ready if we get someone. And that's one of those pretty simple, low-tech kind of things that has been proven to make a difference in some patients.
Well, whether they wanted to or not, every hospital has become a science lab in how to, treat this in a research way. I mean, it's sort of fresh research because all of it is so new. And now I think things have changed a little bit as far as testing within the state. I just want to be clear, you still at NVRH have your hotline where you can get somebody hooked up with a primary care provider, and then they can get tested if the primary care provider believes that it's necessary. But in recent developments in the state, we now have these new pop-up testing events that are happening. And I could put up the website just for a second. I wanted you to bring this up, Laurel, because I know that the St. Johnsbury one has a little bit of a confusing aspect to it. They kind of chose the wrong town.
Well, yeah. So this was, I think we all heard just recently that they're doing the pop-up testing sites around the state, and there is going to be one in our area, which they still list as St. Johnsbury, on May 23rd. But just before I signed on with you guys, I got a news release that the testing site in our area is actually at the Linden Town School, which is on the Lily Pond Road in Lindenville. But you've got the website up, and people can go to the website and get all the information. That you do have to register for that, but it's very convenient for people to go and get tested. And they've also loosened up the requirements. For a long time, they really wanted to make sure that you had some symptoms or travel history or whatever it was, some reason to suspect that you might have COVID-19. And so they're loosening that up a little bit more. And that's completely because of we've got a better availability of testing supplies and testing capability now. So they were able to open that up.
Okay, so just to be clear for all of our audience, if they would like to participate in the testing at Linden Town School on the 23rd, they don't need to get involved with NVRH. This is a separate state program that they sign up directly on the website. Is that and this is not something that you require a recommendation from a primary care provider, because this is doesn't require somebody having symptoms. So what would you recommend, Laurel, for if there's somebody watching this, listening, and they hear that they can go get tested? Who do you think should be the most, I mean, besides people with symptoms, obviously, who do you think should be the most concerned about getting one of these tests?
So I really think that people in our area, if you have a primary care physician or provider, nurse practitioner, or physician assistant, call that office and talk to them about it. Certainly if you have symptoms, for sure, but they're going to know your medical history, because some people are more at risk than others, based on age or whatever your pre-existing medical conditions are. And so talk it through. We still do have our testing tent here that's opened during the week, limited hours, but it's pretty easy. It's the drive-through testing system, and so people don't have to wait until May 23rd till the pop-up testing comes to our area. But I would have that conversation with your healthcare provider. And then, as you mentioned, we set up early on, we have a COVID-19 hotline where people just call the main number to the hospital. It's 748-8141. And then a recording comes on and you press 1, it takes you to the COVID hotline. And we will connect you with one of our local healthcare providers who can kind of walk you through the process if you don't have your own personal healthcare provider here. And I don't have the exact number, but we've had many, many people call that who don't have providers, and it's worked really well. So that's a system that's worked well in our region.
So you would still recommend, even though there is this pop-up testing, to still go through your own primary care provider. And I will say that you said that the MVRH testing is Monday through Friday. One convenience of the state's pop-up testing is that it's on a Saturday, the 23rd. And I do want to reiterate something that the state said, that this testing that they're doing is only for active cases. It's not a serological test. It's not the immunity test. It's not the test that tells you that you have been infected in the past. So you could test negative for this test and have had coronavirus. Maybe you were asymptomatic and you still won't know from this test. So I don't want to give people false assurance about what this test is going to tell you. It's only going to tell you if you have it now. Is that correct?
If you have it now, that's right. And the science is continuing to evolve around the antibody tests, which I think you were kind of referring to, as far as if somebody had it in the past. And they're also not really sure still, because it's so new, this virus is so new to the face of the earth, on how much protection having the antibodies really has or not, and for how long you are protected. But as time goes on, we will find out more about that and learn more about it. And, I know there's work being done with people who have the antibodies and using their plasma. They're doing different tests on people's blood that have had it, just to see, how can we use it and what will we learn from that.
Yeah, I will say that I feel partly responsible, because in the past we assumed that, this is like other viruses, that if you get it, you can't get it a second time. And I even assume that myself. So I want to make sure that message gets out there, that we don't have evidence that guarantees that you can't get it a second time. And so I think that people shouldn't be making that assumption and making those judgments without advice from a medical professional. If they think they've had it and they're like, I can't get it again. I think, Typhoid Mary comes to mind, or something like that.
Yeah. I mean, viruses, to me, they're fascinating, but they're also very frustrating. They're just, to think that, the chickenpox virus, and then 50, 60 years later, you could get shingles. I mean, to me, they're fascinating and frustrating. And, maybe in a another life I would have been a virologist, because they're very, very interesting, but at the same time, like, oh gosh, they don't all act the same. So.
Well, I had the privilege of going to the University of Washington School of Medicine in February, right when everybody was starting to study this. And I went to their virology lab, and I actually got the impression that I think these are the people that are the closest to working with alien invaders of anybody on Earth. It's like microscopic, invisible, but they're like aliens. They'll attack you and you don't know what they're going to do. And so it is like sci-fi made real, working in a virology lab. And I really am so grateful that this has caused so many labs around the world to kick into high gear. And if we get the cures and we get the vaccines, it will be because of all this great collaboration internationally with all these scientists working together. But I wanted to ask you, Laurel, about something that allows the ordinary non-scientist to participate in this. That is contact tracing. I know that that is an old-fashioned way of preventing the spread of disease. And I've heard a lot about how we're going to have to, as a society, start doing this. And I even found, I'm just going to share it real quick, the Johns Hopkins University has a free online course to train people, to train an army of contact tracers. So I wanted to ask you if the hospital has any people who are already trained in contact tracing, or is this something that you're possibly considering using some of the hospital staff for, or is this going to be more of a state thing?
Yeah, so I'm so happy that you said that, because testing alone isn't really the whole answer. I mean, it's part of the answer, and we've been waiting for, the more tests and the quicker turnaround tests. But really, you need several things. You need the testing and the contact tracing, and then being able to have people isolate if you test positive or if you come in contact with someone. What's most likely going to happen in this state, and we're getting more information from the state every day, is they'll be directing the contact tracing. I know they've got, I think there's about 50 people right now that are doing it. As it comes in and someone tests positive, there's somebody that reaches out to find out who they've been in contact. And from what I've heard, they're going to hire probably another 100 people to do that as well. So I think that's going to be led statewide. Now, I don't know if it's all going to come, from the Department of Health central office in Burlington, or if they'll set up regional test people to do this. Certainly, if they reach out to us, we'd be interested in helping them find people. We have people here that work in our medical offices, either for the hospital or for Northern Counties Healthcare, that do a lot of outreach to people anyway. That's something that they could possibly do. Because it's not just a matter of saying, oh, by the way, Bobby, you came in contact with somebody last week who tested positive. They also want to do some follow-up, like, so now you need to quarantine. Are you going to be able to do that? What do you have for resources? Do you have enough food in your house? If you do need to be tested, do you have transportation? So there's a lot of social work involved in doing that contact tracing. But to me, it's also so very important. It's really part of a comprehensive plan to get ahead of this virus.
Well, and it probably wouldn't hurt to have more people in the community who know how to do it. I know the Northeast Kingdom, a lot of folks really want to help. And this is one way that they can prepare themselves for if we do have a resurgence. That I think they'll probably be needing volunteers, and it'd be good. So that Johns Hopkins course is completely free, and I hope anyone who's considering the idea of being a contact tracer. The reason why I bring this up is because there's a lot of talk about using the high-tech cell phone-based apps like Apple and Google, and I know enough people in the Northeast Kingdom to know that there's a lot of people who really cherish their privacy. And there's a lot of people who are very willingly, intentionally low tech. And I know that probably using cell phone data to track this doesn't satisfy everyone. Plus, we all know that Vermont's cell phone coverage is spotty. And so that technology may not work so well here as it would in a big city with plenty of cell phone towers. So I just, has anyone at NVRH looked into the apps, or is there any talk about even promoting a particular digital contact tracing kind of program?
Well, I think we, like you, kind of have been keeping up with some of the options, but we haven't been proactive as far as, doing anything on our end. Yeah, it's pretty fascinating. I'm one of those people that I keep the location mode off of my cell phone. I don't know. I think in this case, I might use that app. Who knows? It might be a little more open. At least to maybe just be part of this, big giant experiment that this feels like sometimes.
Yeah, it is. It is.
I mean, I'm really interested in the kind of the epidemiology part of it and the surveillance data, and so I might look at that as part of, like, I'm one of those people that can help contribute to that.
Yeah. Well, it's fascinating. I mean, I always look at the silver lining in all of this. We are going to be much better at all of this when this is all said and done. And the only good news, I hope, is that, coronavirus, this COVID-19 is not going to be the last pandemic in human history. We can probably be sure of that. But I feel that we are much, much, much wiser with handling pandemics now than we were just 3 months ago as a society. So maybe those apps are, we can find a way to do the tracking with also ensuring privacy. But, being the Vermont, that old-fashioned contact tracing is probably going to work very well here too. So I think we're going to have to use an all the above approach. And one last thing I wanted to mention is because as Vermonters, we are a place that is accustomed to being very welcoming to folks from other parts of the country. A lot of our economy and a lot of our society is based on being a place for tourism, and we want to encourage that. I personally think Vermont is a wonderful place to visit and live, but this also means that we're going to be facing, as the summer weather comes, large numbers of people from cities like New York and Boston. And I've even already heard, walking around in stores, listening to clerks who are on the front lines, that there's a little bit of anxiety whenever they see a car pulling up with New York or Massachusetts plates. I also want to reiterate that I want to commend the governor for being strongly saying strongly that this is not an us versus them situation, and we should not treat these folks as some kind of invading enemy. So I don't know if you have any thoughts on that, because we've got a lot of summer people coming up, and we want to be able to welcome them without at the same time compromising our health here.
Yeah, that's true. It certainly is a balance, but as we said earlier, it's people that spread this. And there are those simple things. And if people come here, they got a summer home or camp somewhere, and they can hunker down for the recommended quarantine period, and when they go out in public, they wear their mask. I mean, I'm kind of assuming if they're coming to Vermont, it's because they want to be alone and not around a lot of people. That's why we live here, and that's why people come here. And so I think as long as people are, aware that, this is spread people to people, and so you need to do your part. And like I said at the beginning, people have done their part, and that's why we've been able to keep it under control here in our state. And I thank you to everyone for doing that.
Yes, I thank all of the folks who've been doing the right protocols for keeping us safe, and I highly encourage you to reach out to anybody who's coming into the state and remind them of how good of a job we've done here, so that we can help recruit them as opposed to have them become something that we see as a source of problem.
Right, well, and offer to go to the grocery store for them and leave the bags outside their door.
Oh, I mean,
so they don't have to come out.
Yeah, though so many stores have become very creative, and that's another great story about the businesses that have adapted. But our time together, Laurel, sadly, is coming to an end. And I just wanted to give you a chance if there's any, I know from talking with you and the other folks at NVRH, like Mike and Sean, that there have been a lot of people in the community that have already been supporting NVRH. But I was wondering if there's any last thoughts that you'd want to tell folks out there, what they can do to support the staff at the hospital, or just to make all of you have a easier time doing your jobs.
Sure, right. Thanks for mentioning that. The community support has been unbelievable. And actually, we're just finishing up celebrating National Nurses Week, and now we're into National Hospital Week. And so we are doing we're trying to celebrate a lot here. We had a free barbecue lunch today, and we've had just tremendous support from everyone. Too many to list, but thank you. It's so appreciated. And I also want to do a special shout out to you guys at the Fairbanks Museum, not only for this program that helps get accurate information out, but also for your virtual field trips you're doing. Those are great.
Oh, well, thank you. Yeah, it's my fun. It's the least I can do. And I really wish I could have kids following me along on all those trips, but at least they can still watch. Well, it's been great working with NVRH. I feel that through all of these talks with you and the other folks there, that anybody who's tuning into these updates should feel very reassured that our local community hospital is ready for whatever is coming. And I thank you, Laurel, for
my video right now.
Getting that information out there. But to make a transition, I want to say goodbye to you. But May, I've also learned, is Mental Health Month. And the folks that we have coming up next are people who are also here to take care of you, not so much your body, but more of your mind. And through all of this COVID-19, I think that the mental health issue has been one that affects everyone, regardless of whether you actually get the virus or not. So I'm very grateful that we have folks from Northeast Kingdom Human Services available. I know it is Mental Health Month, but I've also found out that in addition to all the services that you provide, you also have a 24-hour warm line, I heard it being called. So I wanted to turn it over to you folks. Please, I'm a parent. I have kids that are going through school. I also have to do work from home. I'm going through the ordinary struggle that anybody in that situation is going through. And there's a lot of folks out there who are less fortunate or have more stress on their life, or maybe have also lost their job or have economic prospects that are looking pretty bleak right now. So I think it's fair to say that everyone needs some kind of help at this time. And I'll let you folks take over. Let me know what do you think? What should we be doing, even if we think we're not the kind of person who normally needs mental health services?
Hi, Bobby. Thanks for having us. So maybe we should just introduce ourselves a little bit.
Oh, yes.
Go a little deeper. So Terry and I are from Northeast Kingdom Human Services, and we're going to try to help you get an understanding of what we're doing during the COVID-19 crisis. I work in a couple different departments. I work in the children's department primarily as a school department director, and I also work in our adult outpatient department as a supervisor. And Terry, do you want to introduce yourself?
Sure, and I'm Terry Lavely. I work in intellectual and developmental services, and I run our adult family care program, which is working with elders with chronic medical needs. And we also are part of our zero suicide team at NKHS.
So between the two of you, you kind of handle two different ends of the human story, the beginning and later in the story. Now, I know we will not be sharing any personal information and we will maintain any privacy, but how have you seen the community respond to this? Have you seen what I would expect to be a huge increase in need for services?
Well, I think it's important to mention that the services that we've provided to our clients have not stopped. They've actually just continued. And depending on the services that we were providing, it may have transferred to a different platform, such as what we're doing right now, using Zoom or using phone supports. We've been able to provide supports in that capacity. Some of the programs that Terry supervises, where there's residential facilities, those have continued to go, continue to be provided. They can't stop those kind of services. So just to let you know that the people we were serving prior to COVID-19 are continuing to be served. And the warm lines that we have stood up are available to anybody in the community. They're not just for clients. They're free. open to the public, no insurance required. So I can tell you a little bit about those. They have a 24-hour, 7-day-a-week parent support line, which, as you can imagine, was highly needed and still continues to be. I mean, parents were asked to do so much in such a short amount of time, especially with school closing as we know it and moving to this remote learning environment. Parents were pretty much going nutty and probably still are a little bit. And so the parent support line was set up to be, just an opportunity for parents to get some support in managing their children's behavior. And just, there's so many different questions that folks have. So we're just trying to be available in that capacity. And then the more recent line that we've stood up is the recovery support line. So that right now is a Monday through Friday line from 8:30 in the morning till 5 at night. And I will give you the numbers too. Maybe I can put it in the chat or something like that. Or however you want it, Bobby.
I was going to share your screen actually from your website. But yeah, I know that the crisis number is here. Is it the 1-802?
Well, yeah, so there's a couple of different, crisis. That's why we're distinguishing between hotlines and warm lines.
Okay.
So when you think of crisis, you think more of a hotline. That would be everybody's definition of crisis is different, right? But so if you're a mental health provider, when you're thinking about crisis, you're thinking about somebody who's at risk of harming themselves or somebody else or property. So,
Okay.
Suicide, homicide, that kind of stuff.
Yeah.
That's like super high crisis.
Like emergency
So when
level.
we're talking about the warm lines, it's a little bit, it's not crisis, like, it's more of, maybe they have an urgent need, but it's not like that much of a safety issue. We can triage to our frontline crisis as needed. So just to clarify that, but I can give you those numbers. I think you showed it on the website, but for the St. Johnsbury area, our crisis 24-hour number is 802-748-3181. And
I just put that into chat.
Yep,
So anybody who's
748-3181. And then for the parent support line is 749-1111. There's no 802 needed on that one.
Okay, I'm just typing this in just to have it.
Yeah, sure. And
people.
then the recovery support line, which, as I said, was 8:30 to 5 Monday through Friday, is 749-1112. So one digit different.
Okay, and that's the addiction services recovery?
That's recovery support line, yes. So because you can imagine, that's been a lot of people's coping mechanisms is a lot of people are increasing their consumption of drugs and alcohol to get through this. And so the idea is, some people don't want to do that. They want to, maintain where they were or not use it all. And so just trying to provide that support to folks as we go through this.
Yeah, unfortunately, all of our existing problems did not go away when coronavirus showed up. It just compounded them and added to them. And now I wanted to ask you about children and parents too, Noreen, but I wanted to ask Terry a little bit about the effect on our senior citizens. The specifics of coronavirus have made it so that it seems like if you're a senior citizen, this is like a bullseye on you. It feels like this virus is out to get them. And I imagine that only makes the stress and the anxiety on our senior members of the community even higher. So what have you been hearing, or how have you been helping folks like that?
Yeah, so our elderly population are more fragile through the COVID-19 crisis because of their existing healthcare conditions. So it puts them more at risk. And a lot of the programs we run in adult family care and IDDS are 24/7 home provider or residential living situations. So we've been really supporting people in staying home, but the isolation is one of the intersecting factors for depression and anxiety, especially in our elder population. And as Noreen said, with our folks with substance abuse issues. So we've really been creatively developing programs, visiting people through windows, doing our Zero Suicide team has set up a half-an-hour yoga class that people can do on Wednesday mornings. And that's on the NEK Prosper Mentally Healthy website if you want to get the weekly link there. So we're just trying to keep all of our folks in every program at Northeast Kingdom just as connected as we possibly can. It's really interesting how technology has played a big part in keeping people connected and mentally healthy, even though we can't see each other and be with each other. Seeing somebody on a Zoom screen, to a lot of our individuals that experience isolation, is a big thing for them right now. And even if it's just for a 10-minute chat, and I know at our office, we're doing a lot of Zoom meetings as staff, and like, I haven't seen Noreen in a couple of weeks since our last Zoom meeting. And I'm like, hey, there's Noreen, you know, and we see each other all the time over the years that we've worked together. So just really keeping our seniors and our developmental population and everybody we serve as connected to their community as we can, to minimize the isolation and the effects of anxiety and depression on folks.
Well, I think it's probably safe to say, everyone call your grandma and grandpa too.
Yes.
It really means a lot to them. It is not just, especially nowadays, it's not just an ordinary call. It's, you know, it is really meaningful. And I wanted to ask either one of you who can address this. I know, and then this might also be true, even more so for older generations, that there's sometimes been a stigma associated with getting help. Some people treat it like, oh, I don't need that. I'm tough. I can handle this myself. But I think it's fair to say that the situation that we're all in, there's nobody around today who has been through this before. So the assumption that you don't need help is, you know, we don't, that's, I think, kind of silly. I don't know if you could address this somehow, because, you know, there are people who are from another generation, older generation, that might see that as being a sign of weakness. And there are people who are young like me who might think, I'm fine. I'll just drink another beer and I'll be okay. So I wonder if you could address that. I mean, I think we all need to think about mental health in a different way. This has been the case for a long time. And maybe the stress of this time is the final push to get people to think about mental health services in a new way. I don't know if you want to bring that, how you want to address that.
I think that if we've been working on it for so many years on how to break down the stigma around identifying that you need mental health services and then getting the services. And one of the things that we talk about is it's not mental health or physical health. It's all your health. It's just health. It's being well. And when you're not mentally well, it affects your physical being as well. You can have chest pains, upset stomach, headaches, substance abuse issues, and those kinds of things. But maybe, Noreen, you can speak a little bit more to how we're addressing that. And I think this is a huge step forward in addressing mental health as a healthcare issue, not just physical and mental with separate labels on them.
Yeah, and I would add to that, Terry, that recognizing that you need help is a sign of strength. So
Right.
the idea is, none of us know everything, right? I mean, that's why there's many of us in the world. And so we need other people to help us get through certain things. And that's okay. It's normal and natural. For us to think that we have to get through this by ourselves is actually not normal and natural. That's not the way the life works. One of the things that I've been really noticing, and I think you guys might be able to relate to this as I talk about it, is when we are faced with a trauma, and let's face it, this is trauma now that we're dealing with, we have a certain default way that we respond to trauma. And it's usually one of three things. It's fight, flight, or freeze. Have you ever heard that expression, Bobby?
I've heard fight or flight, the freeze less so, but
right.
I agree that is definitely what happens.
Right. So that's that's our default mode. That doesn't mean that's what we really should do. It's just whatever we were exposed to in our childhood, or however we learn to survive in the world is what if we're acutely exposed to trauma, we tend to default to that mode. It doesn't mean it's always the most effective. So if you're going to fight, that's not necessarily a bad thing to be a fighter, right? It actually can be a sign of strength to be somebody who's going to tough it out and brood it out, and think that they're immune to all challenges. But sometimes it can be a barrier, because then it looks like to other people that you don't need any help and that you got this, but actually you're falling apart on the inside. If you flee, you may be somebody who tends to withdraw, isolate, or you take off, you're sort of aloof, you're not very available. So you're somebody who's just kind of difficult to access. And that may be how you had to cope in your own life, but that also is not something you're not very accessible to other people. And maybe people need you. So you're going to have to learn not to flee. So think about parents, right? Parents maybe their default mode is to flee. Guess what? You can't flee. You got to be here now.
Right.
You got to stay right here, and your kids are freaking out, and they need you. And then those who freeze, they're like paralyzed, like, now what do I do? And we saw this a lot with this whole school moving to the remote learning. We saw that a lot in the school department. Parents just freaking out, like, just not knowing, oh my God, we're expected to educate our children now. And I don't even know how to access these, manage the websites and these kind of things, or we don't even have technology to access the website, just feeling totally paralyzed. So it's really learning all of, how that this COVID-19 is really teaching all of us as to how do we respond to crisis, whether it's working for us or not, and how can we change it, recognizing that we all have that little bit of a default mode. And we're here to help you get through that.
Well, I wanted to reemphasize something that you said about mental health is just health. And I think that is worth repeating over and over again, because if this actually happened to me, if you fall into super cold water, when I was kayaking and it was like 35-degree water, you're not a fool for going to get help. You're not a fool for warming yourself up. You know that your body has been stressed and you could physically die if you don't get the treatment that you need. But for some reason, people hold mental health in a different category. And let's just say that COVID-19 is like falling into cold water. I mean, all of us are stressed. All of us are in a situation that we didn't want to be in, and we don't necessarily know how we're going to get out of it. I just wanted to add something to this, because I feel like I was lucky to get to see a presentation by a social psychologist named Aliris Ullman. And she presented at a conference about space travel. But one of the things that she discovered by studying people who worked in high stress environments, like submarine crews, astronauts, people who were in a nuclear reactor working under high stress environment, that it wasn't a matter of if you were going to have a breakdown. It was simply a matter of when. How much stress, how much time will you last before you get worn out and you need some help? So I want to say that again, because this is a stressful time. And there is nothing normal about what we're going through. So I think some people are just trying to forget about it or kind of move forward without thinking about it. But eventually all of us feel the stress, because we hear about the death toll, or we hear about all the things that we love being shut down. For whatever reason, we're constantly being stressed by this. And Noreen, I had a question only because you deal with younger children and parents. Kids probably have a much harder time understanding why this is going on. This is so strange to them. And if they're so young that they don't get virus, pandemic, all they understand is that my school is closed and I can't see my friends. How have you been able to deal with kids, or what kinds of particular types of strategies have you been using with kids?
Yeah, that's a great question. I mean, at first, you're right. I mean, a lot of kids they just were not understanding, because you can't see COVID-19, it's like, and people are wearing masks, and what is going on? And so one of the things we really needed to help parents understand is to be able to explain to children, in very plain language as to what it is. And we saw some great resources through different media sources about, appropriate for children to explain COVID-19 in their language. And then I just saw a really great little presentation for preschoolers. So, when children learn something called object permanence. So like if you play peekaboo, right? That's how a child learns that, oh, mommy's there behind the hands. So a lot of little kids, they see people with masks and they're like, wait a second, did these people have noses and mouths or what, And so I saw this great thing that was, saying, that showed, yep, they have a nose and mouth under their mask. And when they're home with their families, they take their masks off. So I wasn't even thinking that way. I was thinking more like trauma, like people have been abused for whatever, people have trauma seeing people with masks all day long, that would be traumatic in its own right. But just thinking about little kids and not even understanding the whole object permanence concept. So it's a lot to explain, especially because we can't see it really. It's something to really be able to put down in black and white terms as easy as possible, as simple as possible.
And we've had similar struggles with the developmental service population of them fully understanding, why can't I go to my job? Why can't I go out into the community and bowling with my friends? And the Green Mountain Self Advocates have put out great resources for people with developmental disabilities, intellectual and developmental disabilities, on how to understand what COVID-19 is and explain it in plain language. I have an 8-year-old, and I used a lot of those resources when we first started with her, just so she could understand why she's trapped in this house with me every day, and what's going on and why we wear masks. And I'll say, hey, do you want to go into the store? And she's like, I'm not putting a mask on, I'll sit in the car, and so she understands what's going on and how to keep herself safe. And it's just giving people the education and the tools at a level that they can understand from birth to death, I think, is what our goal is. And I just wanted to go back to the mental health conversation and just share, everybody has mental health. It doesn't mean that you're mentally ill if you suffer from anxiety or depression. We all get sad or worried sometimes. And I think we're going to see a bigger spike in that as we're starting to open up Vermont and people's different levels of worrying. Just because you're worried or sad or you're having a little bit of anxiety or depression does not mean that you're mentally ill. They're two different things, mental health and mental illnesses. Mm-hmm. So I think people need to recognize that as well.
And I would say it's an active maintenance process. It's not, you shouldn't expect, just like you wouldn't expect to keep big muscles without doing exercise. You shouldn't expect to have a healthy mind without, working it out in some ways. And I don't know if there's any things that you can promote for folks who think they've got it all locked down. They think they've got it all together. Oh, not me. I'm not one of those folks. But I think that there are a lot of people who walk around thinking that's for people who have problems. I'm not one of those people who have problems. But what would you recommend? Maybe as I know that everybody might fall on something like meditation or something. But what things have you found work to help people get in touch with their own state of mental health? Maybe even to become more aware, to find out when they're stressed and when they might be needing counseling of some kind.
I always say, get your oil changed. You don't expect your car to run without changing your oil. And every person's individualized. Some people it's physical activity. Some people it's coloring in a book. And you have to test the waters. First, identify that you're feeling that way. And then say, oh, if I'm feeling anxious and I go color in my adult coloring book, I feel better and I feel calm. Or if I blast the music really loud, or if I go call my therapist because I'm feeling more anxious this week, even though I only see him twice a year, you only get a physical once a year. And that's to make sure you're physically healthy. So, get hooked up with a counselor that can work with you individually. And if that counselor is not working for you, that's okay. Look for the next one or somebody else. It's those self-help things, meditation, kayaking, climbing mountains, hopscotch in the driveway. Everybody has their thing that works best for them. And it's not a written prescription. This is what's going to make everybody mentally healthy. We all have to figure out what works best for us. But the first step is identifying, hey, I'm not feeling mentally well today. What do I need to do to take care of myself?
Yeah. And there's some other, obviously, all the things that Terry spoke about. And there's, other things, making sure you're getting enough rest, making sure you're, drinking enough water and you're eating well. Those are all things that contribute to being mentally well. And, of course, if you're looking for counseling, we are able to provide that. The number that we gave earlier can also be a number to make a referral for the counseling, the 748-3181. We have folks that we can, make referrals to for therapy.
Well, personally, planting trees has been the best thing for me this spring. Anything I've been doing outside, having time to be at home. And I'll say that personally, one of the things that I've done during this time is because of the fact that I could stay home longer and not rushing out the door. I'm trying to revise my daily routine to make it more healthy, like making sure, I'll be honest, I'm a kind of person that would rush out the door with a coffee, no breakfast, and, run through the day. Oh, too busy to eat lunch and stress, and then get home and finally relax. And I realized that there's probably better ways to live than that. So I think that this is a good time for that kind of reflection and thinking about how to improve your life now that you have time to think about it. And Noreen, I wanted to ask you something specific that might be something that happens mostly to parents, in which they feel like they put so much of their energy into making sure that their kids are okay that they forget themselves. And I know that there's even some parents who even feel guilty doing things that they enjoy, even if it's just selfish pleasure, because they feel like I should be doing this for my kids, and they end up neglecting themselves. So I don't know if you have any advice, because if there's parents that were tending to be like that, this situation has probably only made that worse, that they may be ignoring their own needs because they have so many kids to deal with, which is a very serious thing.
Right. Well, if you, I always think about when you're on a plane and they go through the whole, like, here's the exits and all this thing. And they always say, if we lose oxygen, the oxygen masks will drop down. And so they always say, make sure you put on your oxygen mask first and then help the person next to you. So that's the same idea as a parent. I mean, you want to make sure that you are able to take good care of yourself, because if you're able to take good care of yourself, then you're able to take better care of the people that rely on you. So that's, how you can justify if people feel guilty about putting themselves. You're not really putting yourselves first. You're actually still putting your children first by being able to make sure that you take good care of yourself. And you're also modeling good behavior too, which is really important.
I agree. I mean, I think, putting yourself at a high state is putting your children at a high priority, because they absolutely need you. That is absolutely true. And I think that is the advice that those kinds of parents do need. And I will say our time together is running low. So before, I don't want to say too much more. I wanted to give you two an opportunity, if there's any parting thoughts you wanted to give our audience. But I will say, just seeing your faces and hearing your words and your wise counsel, I already feel better in the sense that I know that folks like you are out there to help me and my neighbors and friends. And I was aware of Northeast Kingdom Human Services before, but I feel a much greater sense of appreciation for the work that you do. And I'm going to make sure to tell everybody who I know about these services. But before I say any more, what would you like to share with the community as a last parting thought?
I guess I'd like to share that we are here. We haven't gone anywhere. We have not missed a beat in any services that we provide through the whole COVID-19. We have an amazing team, both in our Derby and St. Johnsbury office. And although we are not physically fully in our buildings, we have not stopped serving one individual. And if you need us, call. We would rather get a phone call from you right now when you need us than later on when things are more out of control and it's harder to provide services. So be proactive with your mental health the same way you're proactive with your physical health, because it is all just health. And call us if you need something. We have tons of great programs that people aren't even aware of that we provide from birth to death.
Well, thank you.
Yeah, and I would reiterate what Terry's saying, and just to remind you of these warm lines that we have up and running. And 749-1111 is our parent support line. That's 24/7. Call that any time of day or night, and we'll get back to you. And we have the recovery support line, which is Monday through Friday, 8:30 to 5. So we're here for you with really no strings attached. So I think that's comforting for you to know that we're here. Terry and I and our staff are available for you, and we're just really grateful that you're invited us to join you today.
Yeah, thank you.
Well, in some ways, I wish we had started with you, because I think that the mental health and all this great information that you're giving us today would have been useful earlier on. But we all know we're in the long haul. So folks that are watching this, please let these kind folks help you. Do not suffer needlessly. There is no merit in suffering unnecessary, stress. So I'm so grateful for you two, and I hope everybody listening takes advantage of the amazing services that are available. but it's 2 o'clock and it's time for me to say goodbye. I'm going to miss talking to you two already in just a half an hour. You've made me feel great. So I want folks to know that we are very lucky here in the Northeast Kingdom for a small community with a small population of people. We have over the top quality in the professionals that are here for us, for mental health professionals, and as we saw at MVRH, for physical health professionals. And like you said, let's hope one day those two things will never be separated again. One day people will understand that they are one and the same. So thank you. Thank you so much, Terry and Noreen. It's been great talking with you. I can't exaggerate how much better I feel. So, and unfortunately, it's time to say goodbye. Drew, did we have any last minute questions that came in from the public?
No, I think we're doing pretty good. So I just wanted to, again, reiterate what Bobby said and thank all of our guests today. We really appreciate you taking part and helping us and helping to get good information out to our communities. And of course, we're happy to have you join us on this format. We're of course sad to be saying goodbye to our COVID-19 update and staying at home with Bobby that we've been doing each week for the past month and a half or 2 months now almost. But that doesn't mean that we're disappearing. You can always contact us. You can head over to fairbanksmuseum.org and find a way to contact us on there. Of course, Northern Vermont Regional Hospital will be keeping up all of the good work it's been doing, and their website is a great resource for information for our community as well. So I just want to encourage everybody who might be watching these videos at home or taking part over the past couple of months to continue to keep those communication channels open. And just a warm thank you again to everybody today. A thank you to you, Bobby, of course, for everything you've done in this class over the last 2 months. And I hope everybody has a wonderful rest of their Wednesday.
Yes, be well, everyone. And to everyone who's watched these, I'm very honored to be able to conduct these, and I've gained a lot from learning from these wonderful members of the community. But since this is the last COVID-19 update, I really hope everybody keeps up the good work, keep up the hygiene, keep up the social distancing, and take care of your mind. Make sure that you're okay in every department. So thank you, everyone. Stay well, Northeast Kingdom. And thank you, Drew. Thank you, Terry. Thank you, Noreen. And thank you to Laurel for joining us earlier. I'm signing off, sadly, but knowing that we're in really good hands.
Yep. And have a great day, everyone.